Hi, today I'm going to talk to you about what arthritis is, some causes and symptoms of it, and some possible treatments to it. Arthritis is not just a single disease, it is a disease in your bones and joints. It's also referred to as like a joint disease or joint pain, and it's where it causes like tenderness and soreness into your joints. Um, it is the number one cause for disease in the United States, and it's most commonly in women. Um, and it's not in just in one joint, it is like tenderness and swelling of one or more joints. Um, there is over 100 types of it. Um, and the two main types of it are osteoarthritis and rheumatoid arthritis. And osteoid arthritis is when it damages your joint, and it's like most common in your hands, your knees, your hips, and your spine. And it can damage it damages the whole joint, and it starts to deteriorate the connective tissue, and causes inflammation, damage to the joint lining. Rheumatoid arthritis is caused from your immune system, and it attacks the joints beginning with the lining. It causes that lining to become inflamed and swollen, eventually destroying the cartilage and bones in the joints. And so that's pretty much like the overview of what arthritis is. And so the two main common types, common symptoms of arthritis is like swelling of the joints, like your joints get really big and swelled up. You have trouble moving them, they become like really stiff, and it like makes it hard to like move them and do like daily activities if they're too stiff. It causes a lot of pain, like wherever like you have arthritis in the joints, like causes it pain to move them and stuff. It makes it like red, obviously, when it's swelled up and stuff. It causes redness, and it can decrease the range of motion into it. And so, like, with arthritis, the people who have it, like, some people can feel it when the weather is changing, and, like, others can feel it, like, all the time, like, they hurt all the time. But I know, like, commonly, like, old people, you either get some that can feel it, like, all the time, like, they're constantly hurting, or you get the ones and they're like, well, I can tell the weather's changing and it's getting rainy and stuff outside, because then they start to hurt. I know, like, in the elderly, it prevents them from doing a lot of, like, daily activities. Like, it prevents them from completing their everyday task because they're in pain. So some risk factors of it is, like, you may be at risk, like, due to your age. Like, the older you get, the more you feel it and the more it hurts. So, like, in the elderly, like, they can feel it more. Obesity, because you have more stress on those joints, and so that can cause it too. Your family history, like, if you have a family history of it, like, it's likely for you to get it too. Or if you've had, like, a joint history, like you've broken a bone or something, then it's going to, then you're most likely to develop arthritis in that bone. And so, like, some treatments of it is, like, medications, which you have to find the right treatment that works best for you. Medications might not work best for you, but there is a lot of medications to help with the swelling and the inflammation and pain. So you just have to figure out what works best for you. And then, like, surgery and therapy can both work, which obviously you need to see your doctor, and they'll do like a scan or x-rays and stuff to see like, and probably give you which, or like prescribe you or suggest which one works best for you. So overall, arthritis is very serious and can have a huge impact on your life and prevent you from doing everyday daily tasks. Today I have shared my information from like my knowledge working in nursing homes, the Mayo Clinic, which I looked them up twice, one for the treatments and one for like what it is, and then the Arthritis Foundation, and these are all organizations. So if you think you have any sort of symptoms, you definitely want to seek medical help immediately.